Health Matters. I'm Janet Atkinson, and thanks for joining us as we dig into some of the top-of-mind health issues impacting our rural communities and daily lives. We're joined once again by Dr. Jeffrey Gold, Chancellor of the University of Nebraska Medical Center, and later we will have Dr. Jill Poole joining us as well. Well, Dr. Gold, as always, thanks for taking the time to chat with us this evening. I know that our viewers are certainly looking forward to your updates and the opportunity to ask some questions here later in the show.
Well, thank you, Janet. And there's plenty to talk about tonight about vaccines, booster doses, recent CDC recommendations. But as we always do, let's start off with the data, and let's start off focusing on some of the global trends which are particularly important. As this chart shows, globally, we're at over 4.3 million confirmed deaths worldwide. 207 million confirmed cases, again, totally under measuring the total number of cases worldwide. And when we look at the map of the globe, you can see that not only parts of Europe and Asia, South America, South Africa, but now the United States and the Caribbean islands are brightly colored with some of the highest rates of transmission of the viruses. And when we get into the United States and we start to look at the U.S. data, it's the same type of trends. And again, extremely concerning in that our numbers have shown on a 14-day basis expansion rates of transmission and hospitalization that are over 100% changed over the last 14-day period. When we look at the map of the United States, I'm sure our rural and our urban audience knows that states such as Louisiana, and Arkansas, Mississippi, Florida, parts of Texas, moving further northward and further westward with each week of the show that we're together. You can see that the Pacific Northwest as well has gone from very lightly colored tan and yellow into deeper orange, amber, red, purple, and almost into the darkest hues of purple, indicating the very fastest growth and transmission of this Delta variant of the virus. When we look at some of the numbers, as of midnight last night, the United States is about 39 cases per 100,000 population per day. Now, we have to put that into context, though, because a year ago, that would have meant that was exactly 39 per 100,000 per day. But as it stands today, with approximately 50% of the population vaccinated, we have to consider that as being almost twice as high because of the number of those who are protected by the vaccines. And so if you go back to the graphics, you can see that there are parts of our country now, including Louisiana, that are over 100 cases per 100,000 per day. And this trend line of cases per 100,000 per day across our nation has certainly exceeded the April-May peak, certainly exceeded a year ago in August, and is on a pace to either reach or possibly exceed the peaks we saw in late fall or early winter of last year. And when we look at some of the hospitalization data, you see we're averaging 23 hospitalizations per 100,000 population in the United States. That is up from less than 5 a month and a half ago, almost 5 times. But if you look at Florida, if you look at Louisiana, Mississippi, even Alabama, what we see are hospitalization rates that are not only high and rising rapidly, but tragically are exhausting the healthcare providers in our community. So a lot of concern, Janet, a lot of need to reinforce the need for vaccination, mask wearing, and other non-pharmacologic interventions. And so with that, we very much look forward to answering the questions of our audience. Again, trend lines on hospitalization continuing to rise. If we look at some of the data on deaths, again, U.S. average is 0.2 per 100,000 per day, but no surprise that Louisiana is almost 5 times that. Arkansas is 4 times that. just a trend line, and even with death being a lagging indicator, a trend line that is so tragic. Again, these are family members, friends, colleagues, school classmates, and let's not lose sight of the fact that the average age of hospitalization has fallen from the 70s to the 60s to the 50s to the 40s, and we now have people in their 20s and even in their teens. Children's hospitals are seeing an unprecedented number of admissions, all-time high, with children under the age of 18 who are being hospitalized with COVID. So just a lot of concern, a lot of anxiety. If we look at some of the smaller rural counties, whether it's in Stone County, Mississippi, or Columbia, Florida, or Wayne County in Mississippi, U.S. average of 39 cases per 100,000 per day. We have communities here that are over 300, over 200 cases per 100,000 per day. There is no way that that is not totally taxing our healthcare system, exhausting our frontline healthcare workers, and just underscoring the need for us to work together as a community in rural and urban America to try to punctuate this rate of spread.
Dr. Gold, you touched on this. Again, this is causing our hospitals to fill up across the countryside. The data is reflecting this to some degree, but are you hearing it more and more where hospitals just don't have space?
Well, the hospitals not only don't have space, but they're running out of physical beds, they're running out of supplies, and I think, as our audience knows, we've talked a lot about this in the past, our frontline healthcare workers, our nurses, pharmacists, therapists, our environmental service people, our dietitians, social workers, and others are exhausted. I mean, let's not forget that they've been doing this for a year and a half now, approximately. And so this is not a one-time surge that we typically see with annual flu or with RSV in children or other such things. This has been just a sustained effort. And, we can't lose track of the fact that, unfortunately, people are having heart attacks and strokes. Women are having children. And so our healthcare systems are actively engaged with their business of the day. And at the same time, all of these fractures, heart attacks, strokes, all the labor and delivery work, all the usual childhood cancers and adult cancers that have to be diagnosed and treated are filling our hospital systems as well. And so our frontline healthcare teams are exhausted, and frankly, there's no immediate end in sight to this. And my thoughts and prayers go out to them and go out to their families. Fortunately, most of them are vaccinated and have tried very hard to protect themselves and in so doing protect our patients. But that doesn't remove the stress of the endless hours of hard work and dedication.
Doctor, does the large growth of the Delta variant that I know you've talked about a lot here on the show throughout the last couple of months, does the large growth of that variant mean that we may need another COVID vaccine targeted towards it directly?
Well, we are very fortunate that the current vaccines are effective, slightly less than they were originally, but are still effective against the COVID variant. We've heard just recently from the Food and Drug Administration that they're recommending a third dose of vaccine for individuals that are having a weakened immune system. So think about individuals that have had a solid organ transplant, such as kidney or liver, those individuals that have had a bone marrow transplant, individuals that are being treated for cancer or are on medications that may suppress their immune system. But there are also vaccines that are being actively developed right now with specific capabilities against the Delta variant. Pfizer and Moderna are both working on those, and there are a number of other manufacturers that are in clinical trials as well. So I think it's pretty clear that booster doses are going to be recommended, and newer variants are going to require that booster doses be specific over time to those variants. Not totally dissimilar to what we see with influenza every year when we ask people to roll up their sleeves for the next generation of flu vaccine. But I think the next generation of widely available COVID boosters is likely going to be in the next 30 days, even for those that are not considered to be with weakened immune systems.
Dr. Gold, do you have an idea what the immunization rates is? And you may have mentioned it, I just missed it, but the percentage that maybe even Nebraska or nationwide that seems to be vaccinated so far?
Sure. If we go back to the graphics, we have a couple of slides on that, Janet, and we can just quickly run through them for the audience. There are, of course, 3 vaccines that are fully approved in the United States. There are another 5 worldwide in China, India, parts of Russia, being used in South America, etc. And of those, if you look at the numbers, 50% of Americans currently are fully vaxxed. That would be all ages of individuals. Those that are 12 and up, we're just over 59%, which is the population that has FDA approval. We are definitely lagging in the 12 to 18-year age group. Those that are 18 years of age and older, Janet, 62% vaxxed. And those that are 65 years of age and older, they're currently 81% vaxxed. And those numbers are rising, which is good news. Our 7-day running average now is just over 700,000, almost 750,000 doses per day. Of course, we peaked out in late April at about 3.5 million doses per day, and we dropped in early July to just over 500,000 doses per day. So at 700,000 doses per day, we're getting there, but obviously a lot more slowly. And let's just say the virus is getting ahead of us in many different parts of the country. And based upon these projections, you can see the Northeast, California, the state of Washington, the state of Illinois has got some of the highest vax rates in the country. Nowhere yet total herd immunity, at least based on case transmission rates, but rapidly approaching it. Even in Florida, parts of Texas are rapidly approaching a higher level as well, which is really good news given the transmission rates. If you look at some of the CDC projections, 70% of the total population is projected at this rate to be immune by the end of October, 85% by the beginning of February. And right now, you know, given this variant, it's unclear exactly what, quote, herd immunity means. That is to say, what would be the total population that would allow us to declare victory here. We are much more focused on case transmission rates, hospitalizations, and death than we are in the percentage of the population that's immune. But if you use traditional public health characterizations based upon what they call the R0, or the reproduction rate of the virus, that would mean we would have to get to 85% of the population or higher. So at this rate of vaccination, we got a long road ahead of us.
Dr. Gold, I'm sure we're going to talk about this a couple of times throughout the hour, but before we take a quick break, what is your best advice that folks need to consider? Of course, it is get the vaccine, but I'm sure you've got another tidbit or two to share.
Yeah, you know, Janet, this is the way I think about it, and I've probably shared this before with our audience. It's sort of like driving a car. You know, I think of the vaccines like wearing your seatbelt. We know seatbelts save lives for passengers and for drivers, unquestionably. But we also know that observing traffic signals, stop signs, being aware of other drivers around you, what I would call safe driving, also saves lives in many different ways and is complementary to wearing a seatbelt. And that's things like social distancing, wearing a mask when you're indoors. If you're sick, get tested and stay home. If you're with a family member who's sick, you know, get tested as well. All the common sense non-pharmacologic interventions, or NPIs. You know, when I get behind the wheel, and I'm sure for our audience, we put on our seatbelt. We also try to drive as safely as we possibly can. We don't drive when we're under the influence, or, you know, we just take the usual precautions. So why wouldn't we wear a seatbelt and drive safely when it comes to COVID? That's what it's going to take to accelerate it and get us to the goal that we want faster and better, particularly as we're heading back to school and class, and life in the fall is going to be more indoor events. We're going to need to be very aware of these considerations.
Doctor, I have to admit, during the cold and flu season, I myself bump up my vitamin intake and definitely get more vitamin C into the mix. Is that something else that you kind of recommend?
There is no question that healthy eating, supplemental vitamins, getting enough sleep, getting exercise, just generally the things that we know that we take care of ourselves and take care of our loved ones. And being particularly cautious, frankly, about those that are older and those that have weakened immune systems, because we've proven over and over again with COVID, but with every other infection, that the older you are, the harder it is to fight the infection. If you happen to be being also treated for cancer or heart disease or kidney disease or liver disease or whatever, you're also more vulnerable. If you're on medications that weaken your immune system, you're more vulnerable. So we need to take extra special care for those that we love, live with, work with, etc.
Right.
We'll get through this. It's just about taking care of the communities that we love.
Well, again, we're going to take a quick break. We are talking with Dr. Gold. We will visit with him again when we're joined by also Dr. Jill Poole. She's a physician scientist who conducts groundbreaking research at UNMC. Stay with us. And welcome back to Rural Health Matters. Well, joining us once again, world-renowned Dr. Jeffrey Gold, the Chancellor of the University of Nebraska Medical Center. And now we also welcome Dr. Jill Poole. She's a physician scientist who both sees patients and conducts groundbreaking research as chief of the UNMC Department of Internal Medicine's Division of Allergy and Immunology. And thank you, of course, for joining us here, Dr. Poole. As you heard, the conversation is certainly getting going. If you would, tell us a little bit about yourself so we could get to know you better and dive into some of the research you're conducting.
Thank you, Janet. I am a native of Nebraska. I'm from Grand Island, Nebraska originally, and I've been at the University of Nebraska Medical Center since 2005. I'm currently serving as the chief of the Allergy and Immunology Division at UNMC, and I've also have federal grants for which we do active research, with our most recent research project that was just published having to do with certain proteins in the lung that are actually lacking in those who died, unfortunately, of their COVID infection, and how that compares to others with chronic lung disease. And so we've gotten to do some research into COVID pneumonia and COVID deaths.
Now, before we dive completely into the COVID pool, I also want to ask about this. Now, I understand that you're conducting research with farmers and ag workers on inhaling dust in agricultural environments. Can you touch on that research and what you've discovered?
Yes, my long-standing career is on agricultural exposures and how that affects lung disease. And what we have found is that it is very inflammatory. So it causes a lot of lung inflammation and a lot of respiratory symptoms, which farmers and agricultural workers are very well aware of, such as cough, shortness of breath, and respiratory symptoms, as well as upper respiratory symptoms as well. And we've studied different means to which to try to prevent the inflammation or to block it is where our lab is going. And we've also discovered that inhaling these agricultural dusts repetitively can also cause systemic inflammation and arthritis and joint problems.
Good reason to have that protection available. Now, our phone lines are open, and we'd love to hear from you this evening. What questions do you have for our guests tonight? That's 877-731-6733. Again, 877-731-6733. And Dr. Poole, I had one more question related to your research efforts there in agriculture. What is one of the most common allergies that you hear from folks? And of course, that's not necessarily agriculture, but is something that affects a lot of people.
Well, at this time of year, we're starting to see the weed pollen. So the weed pollen is starting to increase, particularly in our neck of the woods. We're seeing ragweed, but there's lots of weeds that are pollinating. We just kind of on the tail end of the grass pollen. The tree pollen was earlier in the year. But we also see a lot of indoor allergens, such as dust mites. Farmers can see storage mites as well. And then their animals are also problematic.
We do love our animals, though, nonetheless. And here's a question for both of you. Is there maybe any kind of a best common sense solution that you suggest for allergy sufferers?
Well, there's a lot of over-the-counter medications that are available. One of my favorites is the sinus rinse that one can buy to irrigate out the nasal passages. There's also over-the-counter antihistamines, the long-acting ones that are non-sedating. And there's nasal steroid sprays that are also over-the-counter. So there are a lot of over-the-counter remedies that one should try first.
Dr. Gold, anything else you might like to add to that?
Well, you know, what I'd like to discuss briefly with Dr. Poole is this question of individuals who express concerns about being very allergic and therefore are either afraid or reluctant to get vaccinated to not just to COVID, but frankly to anything. And, you know, I think as our audience has heard us say many times, these vaccines, the virus vector vaccines, the mRNA vaccines, are really unique vaccines, and that we have not seen them. I mean, the only previous mRNA vaccine I think that's been ever rolled out has been really experimental, and the only virus vector vaccine that's been rolled out has been Ebola virus vaccine, and other than a very small number of people who have traveled to Western Africa to attempt to treat and mitigate Ebola virus spread, that's probably not the largest number of American citizens. So when people talk about that, and I'm sure you get asked this question, Dr. Poole, all the time, are we seeing allergic reactions to these vaccines, you know, that we're using for COVID? And if people have significant allergies to pollen or to foods or to dust mites, is that a predictor of a reaction to the vaccines?
Oh, these are just excellent questions that we're getting. We are seeing, and we are having an allergy clinic for people that have these concerns that want to come and talk to us. But to answer your question it's very, very rare to see an anaphylactic or allergic reaction to these mRNA vaccines. It's more common to have some of the adverse reactions, whether that be, you know, sore arm, muscle pains and aches, not feeling well, that can last maybe a day or up to 3 days is most commonly what we're seeing. But severe allergic anaphylactic reactions are rare. And I've been noticing a lot of patients are hesitant to get the vaccine based on having underlying allergies, such as that to trees or grasses, weeds, or foods. And that is completely not a contraindication to the vaccine. And so we alleviate those fears and allow them to proceed with the vaccination because it's been really relatively safe.
Well, doctors, our phone lines are open, and of course, we're looking forward to hearing from folks. That number is 877-731-6733. And with that being said, we have Barbara on the line with us today. She's from Missouri. Barbara, go ahead with your question or comment.
Thank you, Janet, and thank you, Dr. Gold and Dr. Poole. Sorry, my question is kind of unrelated to what you're talking about, but we were at a restaurant recently. We wear KN95 masks to and from, and only took them off when we were eating or drinking. And afterwards, my husband was chatting with the waiter who shared how he wasn't vaccinated, he wasn't masked, he wasn't vaccinated, but he felt fine, he said. I'd like to hear from both of you. Would you go back to that restaurant?
Doctors?
Well, I'll take a shot at it, and that is the restaurants that I have frequented, which have been relatively rare, typically have capabilities for outdoor dining, and the wait staff, the cashiers, the people that do the seating are masked. And while I'm not sure whether the establishment requires it or whether it's just best practice that they want to be protected, because don't forget, of course, when we sit down at the table and enjoy beverage and food, we are not masked. And so that not only puts us at risk with other guests and customers in the restaurant, but it puts the staff at risk for being exposed to people who are eating and drinking as well. I know that in some parts of the country, you actually need to show a vaccine card, you know, a federal vaccine card to get seated for indoor dining in a restaurant. I don't know, Dr. Poole, would you go back to that restaurant a second time? I'm guessing probably not, right?
I would certainly think about it and plan on maybe sitting outside. Depends on how good the food is.
Well, with that, we have another caller on the line. And Barbara, thank you for your question there from the Show Me State. We have Gerald from the Lone Star State now on the line with us. Gerald from Texas, go ahead with your question or comment.
Dr. Gold, first I'd like to congratulate you. I think the most quality information that we're getting is from you. But anyway, I have a grandson that's going to college this fall, and he has an allergy, lots of allergies, a very severe peanut allergy. He also has asthma, and he's had the Johnson & Johnson. And frankly, I don't hear very much good about that. Today I read where there isn't even a booster for that one, and mostly negative. And nobody really wants to come clean on that. And I wonder if you would tell us everything you know about how good the Johnson & Johnson vaccine is. Thank you very much.
Well, thank you for your kind words, Gerald, and best regards to the folks in the Lone Star State. There's been a lot written about the J&J Janssen vaccine. It is the only virus vector vaccine that is currently FDA, EUA certified in the United States. AstraZeneca, which is also a virus vector vaccine extensively used in Europe and in the Middle East and in the Far East, is in the process of being considered by the Food and Drug Administration, probably for a full certification at some time, hopefully in the near future. But in answer to your question, in the original clinical trials of the J&J product, it was quite effective against the wild type, the original variant of the virus. It was not quite as 95 or 94% effective as the mRNA vaccines were, but it was quite effective. It is less effective against Delta variant, but so are the mRNA vaccines, the Pfizer and the Moderna products. The reason, I am told, but that the FDA did not make a booster recommendation for the J&J vaccine is that they just don't have enough data. The largest preponderance of vaccination in the United States right now is with Pfizer product, very closely followed by Moderna product. And the J&J product has fallen down to well under 5% of the total vaccines. There is little question in my mind that at some point boosters for the J&J product will be recommended. Whether it will be a second dose of J&J or a dose of one of the mRNA vaccines remains to be seen, or whether it will be one of these newer protein construct vaccines, such as the Novavax product that has completed clinical trials and is being evaluated today. I certainly think that your grandson who's going to college, it's great that he's vaccinated, but given his asthma, given all of his allergies, I would say just as soon as he can get a booster shot, he ought to roll up his sleeve. And frankly, if I were his mom or dad, I'd give a call to the allergist or to the pulmonary care doctor that takes care of his asthma or his allergies and see what they think. Maybe there's some way that either through, what's referred to as compassionate use, they might consider enrolling him in a clinical trial in one of these new products, or at least put him in first in line for when the booster doses become available.
Thank you for your call, Gerald. And again, that was Gerald out of Texas. Dr. Poole, I want to turn my attention back to you now as someone who studies how other diseases, of course, affect the lungs, whether that's the various things that are out there, asthma, COPD, or end-stage lung disease. Give us a little bit of insight, or does this give us a little bit of insight into COVID-19?
Well, having chronic lung disease has been a risk factor for COVID, especially diseases such as COPD, chronic bronchitis, fibrotic lung disease. And it just came out recently that having severe asthma is also a risk factor for COVID. And then studying these diseases and then looking in the lungs of these tissues, we've been finding some key proteins that are differentially up or down in the lung. And our recent studies focused on one called IL-33 or interleukin-33, which was a real important protein that there's drug development against, and whether or not it'll be important in COVID. We don't know. It's way too soon. But we know that some of these inflammatory markers, when you're admitted to the hospital, are super high. And these super high levels we're calling a storm of sort. And having these super high levels is actually not a good prognosis for how one will do if they get COVID. The higher these levels, perhaps the more likely they are to succumb from the disease. And so we're looking for perhaps not so much of a robust immune response. And whether or not we block these in the future, time will tell, and research is ongoing.
Well, at least we know that's a potential marker for severe disease and death, and maybe that's an opportunity for intervention at some time.
Yes, that's what we're excited about learning more about and following these levels.
Thank you, doctors. Now, again, our phone lines are open. If you happen to have a question for our guest, 877-731-6733 is the number to call. And with that, we have Buddy from North Carolina on the line with us. Betty is on the line with us. Betty, go ahead with your call or your question or comment.
Yes, hello. Thank you for taking my call. I have asthma and a lot of allergies. I have been told not to take any of the shots for the COVID. Is there anything you can recommend, or is there one of the vaccines that would be better for me?
Betty, good question, Betty, right in line. Go ahead with your comment there, or your statement, Dr. Poole.
Well, Betty, I guess I might get another opinion from your physician, because what we are highly recommending is that you would get the vaccine, as that will be quite helpful in protecting you against getting an adverse outcome if you were to get the infection. As severe asthma is a risk factor for poor outcomes if you have asthma. And you haven't said anything that would preclude you from getting the vaccine from what you've told me so far. And that's partly why there's different choices of the different mRNA or the Johnson & Johnson. Some people who are scared to get the two vaccines do prefer just getting the one Johnson & Johnson, so they don't have to go through worries for two. But we do both the Johnson & Johnson vaccine or the mRNA vaccines as well. And then the other things that you can do, there's been, like Dr. Gold alluded to earlier, healthy diets. Vitamin D continues to become a vitamin that I've studied in the past, and others have studied with COVID, that it's good to have good levels of vitamin D. Whether you take that by supplement or by your diet, it's pretty hard to get enough vitamin D in your diet. Supplements may be necessary, and other vitamins have been talked about as well that you can talk to your physician about. And then it's really important that you're on your medications, and this isn't a time to stop your allergy and asthma medications, because you really want to have your asthma and your disease as well controlled as possible.
What we didn't talk about, and maybe it might be some advice and reassurance for Betty, is rather than getting her vaccine in a local pharmacy or food store, maybe it's best done in her physician's office or in a hospital clinic or someplace where they're fully staffed with a lot of medical personnel. And I know we run a vaccine clinic. You run a vaccine clinic like that. Is that not right?
Oh, that is absolutely correct. For our employees at Nebraska Medical Center, the University of Nebraska Medical Center, we helped out with if there were any concerns with the second vaccine. And we opened up a few weeks ago a allergy COVID vaccine concern clinic. If you have concerns about your allergies or anything of a concern for getting the vaccine, we have special slots open. And in these slots, we anticipate it could be anywhere from 30 minutes to 3 hours on how we would provide the vaccine. Some we've recommended pre-medication, such as an antihistamines or Tylenol, pre-vaccine, and then we monitor. And if we have to do any testing, we will, but for the most part, we've just been giving the vaccine and observing the patients, and they've all been doing really quite well. But these are services that I think you could probably ask your physician for, and or seek in the community help.
Well, Betty, thank you for your call. That was Betty from North Carolina. Again, our phone lines are open, 877-731-6733. And we have a caller from New York now, and Bob is on the line from New York. Bob, go ahead with your question or comment.
Yes, I'd like to ask Dr. Gold. We've had our COVID shots way back in February. Are we still going to have our flu shots this fall?
Regrettably, sir, yes. You're going to need your flu shot this fall, and you're probably going to be needing a booster shot, even if you're otherwise healthy. Current advice is not to do both at the same time, even if that's offered to you. There was some thought early on about pairing them, but it's probably better not to do that, just to be sure that we can separate the effects of the two shots. Now, one of the interesting things that I've seen is that I've started to see medical centers across the country starting to encourage folks to get their flu shots extra early, meaning starting in the next several weeks. And I don't know, Dr. Poole, if you've seen much of that. I know we haven't started the flu campaign just yet.
Well, you're right. We haven't started it yet. I'm not aware that we have the vaccine available to give anyone at this time. But as soon as the vaccines become available, I would highly recommend that you go get in line and as you said, roll up your sleeve and get your vaccine for both the flu and when the booster becomes available for that as well.
Well, doctors, if someone happens to have maybe a milder case of COVID-19, could they just maybe confuse it and think maybe it is allergies? What are the signs that they need to look for?
Well, for COVID, the symptoms such as fevers, chills, some very strong muscle and body aches, difficulty breathing, and very chest tightness and a cough are more going to be COVID versus allergy. With allergy symptoms that we're starting to see here for the weed pollen, you're going to get more of the sneezing, itchiness. Itchy is always a big sign for allergy and not a sign of COVID. Both can have sore throats. Both you can lose your loss of taste or smell, although that tends to be a little bit more common with COVID than it is allergies, but that won't really help discern completely. And if the over-the-counter medications aren't helping for allergy, and this is persisting or getting worse, then these are patients that need to really be checked out.
Wouldn't you say also that if there's any question, just go get tested? I mean, it is so available. It is so easy now to do it, and you get results quickly. You know, the last thing that you'd want to do, even if you're pretty sure it's your allergies, is spread the disease to either a child who can't be immunized or to an older individual whose immune system is weakened, somebody being treated for cancer or heart disease. So, you know, our advice, my personal advice is when in doubt, just get tested.
Doctors, you mentioned this earlier, that allergic reactions to the vaccines are few and far between, but they have happened. Now that you guys and others are working through this, you're working through so the allergic reactions can be better managed. How are you going about that?
Well, it's very complicated, and we have to start with really just taking a very thorough history and physical examination of the patient. To know really what the details were, and then making decisions based upon that. A lot of the first dose reactions really weren't, the vast majority of them weren't allergic in nature.
Well, remember, our phone lines are open, and we want to hear from you. You can call in and ask questions of our guests. The number to call is 877-731-6733. Of course, more Rural Health Matters coming back at you in just a moment. And welcome back once again to Rural Health Matters. Our phone lines are open, and we want to hear from you. You can call us this evening, 877-731-6733. And joining us once again, of course, Dr. Jeffrey Gold. He's the Chancellor of the University of Nebraska Medical Center, and Dr. Jill Poole. She's with the UNMC Department of Internal Medicine's Division of Allergy and Immunology. Now, with that, we said the phone lines are open, and we have a caller on the line. We have Lonnie out of Maine joining us here this evening. Lonnie, go ahead with your question or comment.
Yes, hello. Thank you for taking my call. My husband and I are 80 and 77 respectively. We both have been vaccinated with the 2 Moderna shots as of February and are looking forward to the booster to come. My question is, these free shots we know we are paying for as taxpayers in this country, and I'm wondering what is the actual cost of a vaccination for the COVID? Thank you.
Doctors?
Yeah, you know, Lonnie, that is a great question, because the costs are the cost of what it takes to produce the actual vaccine material itself. The costs are the costs of the research and development that went into it. And then, of course, all the packaging, shipment, logistics of getting the vaccine into your arm, et cetera. I guess at the end of the day, the 100 micrograms of vaccine, the cost of that is really de minimis. I'm going to bet it's pennies or just a couple of dollars. But the production costs, the shipment costs, et cetera, are probably far more. Do you have any more insight into that, Dr. Poole? What does a dose actually cost to produce?
I'm actually not sure what the actual cost of this is.
I would say, as some might say, it's priceless.
Certainly the breakdown of a lot of numbers and a lot of research. Well, Dr. Poole, now in your study of lungs, as you mentioned earlier, patients who specifically, of course, regarding patients who failed to survive COVID-19, what do you see and what does it tell you from your research of those folks?
Well, it's a devastating, obviously, consequence of this infection. And the lungs from these individuals who unfortunately died from COVID, they are very dysregular. The structure of the lungs is abnormal. There's a lot of fibrotic markers in the lung tissue itself. We were also fortunate to get a lung of a survivor of COVID who had a transplant, and we saw that in the lung that survived, they were actually able to recover these proteins that were lacking, but due to all of the dysfunction and dysregularities within the lung itself, it just couldn't heal appropriately.
And, let me ask you a bit about this. Have you seen many patients with lung abnormalities in the setting of a long haul type of syndrome? In other words, people, for instance, who have known serious allergy disease, possibly asthma, et cetera, are they more prone to long-haul issues, particularly if they were hospitalized for COVID?
Well, the patients that have been hospitalized and some of the patients that were in the ICU, they have had prolonged oxygen use. They've had prolonged abnormalities on their CT scan. And patients that had COVID last summer are still on oxygen. Obviously, there's a spectrum of those who have fully recovered and are back to work and doing great, and unfortunately, those who have not recovered. And at the University of Nebraska Med Center, we have also opened up a post-COVID clinic for those who unfortunately haven't recovered from their COVID infection, whether that be and it's a multidisciplinary group, meaning that we have pulmonologists, cardiologists, general internists, neurologists, psychiatrists, as there's been a lot of symptoms that have been part of this long haul, including those, and I have my own patients who are part of this clinic because they have not fully recovered, and now a year past the infection, and are requiring oxygen.
Yeah, so I'm aware of at least one faculty member, colleague, who's still on home oxygen now more than a year past infection. And just this last weekend, I became aware of the child of a good friend of mine, a 16-year-old, very accomplished high school athlete who had COVID back in April and is dealing with one of the unusual long-term cardiac effects, and is so limited that not only that he cannot participate in high school sports, but he's struggling to walk up a flight of stairs or even down the hall at a good clip. So, while some of these long-term complications are quite rare, they can be devastating and across all of the ages.
Well, the hour is winding down, but we do still have our phone lines open. The number to call is 877-731-6733. And with that, we have Audrey from Minnesota on the line with us. Audrey, go ahead with your question or comment.
you for all the information you give us on your program. I appreciate it very much, and I'm sure everyone else does too. My question is about the booster vaccine. Has the booster vaccine been approved?
Doctors?
Well, Audrey, thank you very much for your kind words. We do try to provide, very understandable, scientifically based information, and that's been the goal, and we've been doing this now consistently around COVID with the RFD-TV folks now back since March of 2020. Hard to believe. Every Monday night we gather together for this. The answer to the question is yes. The booster shots, which right now are both the Pfizer and the Moderna mRNA vaccines, are the same vaccines that have been emergency use authorized by the Food and Drug Administration back last December. There are no new products, so these are the same two vaccines, same two messenger RNA or mRNA vaccines that received emergency use authorization, back in December. Now, having said that, both of those products are in the final stages of a full Food and Drug Administration approval. That is to say, to go beyond emergency use authorization, which is just a matter of time and study, into full FDA approval. And the current thinking is at least one, if not both of these products, will be fully FDA approved probably in the next several weeks. Current thinking is either by the end of this month or hopefully by the time of the Labor Day weekend.
Now, doctors, you touched on this earlier before the break, but circling back to the idea of the allergic reaction, some folks are very concerned about having an allergic reaction to the vaccines. Is this something that the average person should be concerned about?
I think that the average person should go and get their vaccine as soon as possible. Having, over 50% of Americans have allergies, whether it be via allergic nasal symptoms or may have food allergies or have some allergy history. And the vast, vast majority of these patients can safely get any one of the COVID vaccines that's available. What I've been recommending my allergy patients is just stay on your allergy medications and wait the 30 minutes after the vaccination so you can be observed at a healthcare facility if you're concerned, or again, talk to your physician to see if you can be observed in their clinic. But for people with allergies, again, we really haven't seen any contraindications for the vast majority of people.
With that, let's go back to the phone lines, and we have Patty from Georgia on the line with us now. Patty, go ahead with your question or comment.
Yes, thank you. Currently, right now, I have COVID. I have not been vaccinated, but tomorrow I go to have the monoclonal, easy for me to say, I can't say it, infusion. And I was wondering if this will prevent my body from building natural antibodies.
Doctors?
Well, Patty, I'm sorry to hear that that you have COVID, but it's really great news because the monoclonal antibody therapy is extremely effective for people who have COVID, particularly people who are at a relatively early stage of the disease. So these are antibodies that are manufactured by the pharmaceutical companies to specifically attack the virus. So it mimics the fact as if your body was able to make your own antibodies. It will not in any way lower your need to ultimately be vaccinated, but you're probably going to, if I believe the current CDC recommendations is, I believe you're going to want to wait 30 days after you receive the monoclonal therapy. And I'm looking towards Dr. Poole, who probably knows this better than I do. Is that pretty accurate?
Yeah, I think they're still recommending at least 30 days.
Well, Linda, we hope that goes well that's Patty from Georgia. Up next, we have Linda from Missouri to round out our phone calls here this evening. Linda, I'll let you go ahead with your question.
Okay. Good evening. Well, my question is, we're in our late 50s, and we have some of our family living with us in our home. And one of them's a small child of 3.5, and they go to preschool. They come home a lot of times sick with a cough or cold or whatever. Should that be a huge concern for us?
Well, you know, as we know, our young children, particularly those that are in early childhood preschool, are vectors for just about every infection known to mankind. Indeed, I have 5-year-old grandchildren, and certainly have seen that more than once. They're better in 2 days, and the parents and grandparents, well, it's a totally different story. We also know that when you bring young children together, one, they can carry and transmit the virus even if they have no symptoms. And secondly, that as they get back to school, that their risk of being, indoors, potentially if there's less than adequate ventilation and air exchange, no masks, it's hard to get 2-year-olds and 3-year-olds to mask up effectively, that's going to increase the risk. So our best advice is to just take precautions, a lot of hand washing, try to pick a preschool or an early childhood center that at least the staff and the teachers are fully vaxxed. And again, take those non-pharmacologic intervention precautions. And if there's any concern, particularly if one of the parents or grandparents starts to have some congestion, low-grade fever, or just not feeling right, get tested, because as our previous caller indicated, some of these therapies are extremely effective now in keeping people out of the hospital and markedly shortening the course of COVID, particularly with Delta variant. Do you have any other advice for families with young kids under this situation?
I wholeheartly agree with you. Doing all of the precautions that you can, having yourself vaccinated and then boosters when available. And then, again, things like hand washing, vitamin D, and a healthy, balanced diet is recommended.
Well, thank you, Linda, for your question. We started the night with a call from Missouri. We ended the calls with a call from Missouri, so we had some consistency on that front. Doctors, we've only got about a minute left. Any last thoughts, Dr. Gold?
Yeah, just of course to thank you and to thank Dr. Poole for joining us this evening, and just to underscore the fact that this Delta variant has created a whole different level of concern. Many folks think of it as a second pandemic, and we need to treat it with a huge amount of respect. It is more transmissible, causes a lot of hospitalization, affects our children and our younger adults. We just need to get vaccinated, take all the necessary precautions, and we'll get through this just fine.
Well, doctors, thank you very much for taking the time to join us. We certainly appreciate it. Covered a lot of ground tonight, answered a lot of questions. Of note, only one repeat state as far as the calls came in. So we covered a lot of ground tonight as far as just across the countryside where interest was coming in, folks inquiring what's going on. So again, thank you for joining us. Again, UNMC Chancellor Dr. Jeffrey Gold and also Dr. Jill Poole joining us out of Nebraska. Now, if we did not get to your question this evening, you can still call and leave us a voice recording on our hotline of your question or the comment that you'd like to share. The number to call is 855-776-6147. Now, again, that's different than the number that you call in for the live show. The number for leaving a voicemail message, 855-776-6147. And remember, you can catch Rural Health Matters every Monday night at 6 p.m. Eastern, 5 Central. Thanks for joining us.